I'm Christine Pitawanich. We begin here at 11 with a follow-up to an issue several counties in our area are dealing with: slow ambulance response times. It is something our KGW investigative team has been digging into now for years.
Well, the bottom line, an increase in calls for help combined with difficulty hiring paramedics means sometimes there is no ambulance to respond in an emergency. That is known as level 0. While Multnomah County is struggling the most due to a policy that requires 2 paramedics per ambulance, this is not an isolated issue, with Clark County also experiencing calls with no ambulance available. And now one fire district is doing something about it. Alma McCarty's in the newsroom. And Alma, you went to get a firsthand look here.
Yeah, David, Christine, we are talking about Clark County Fire District 6. For $49,000, they bought a used ambulance for firefighters to transport patients when AMR isn't available.
New to the fleet in Clark County.
It was a fairly inexpensive way to provide that extra level of safety for our citizens.
An ambulance purchased used from a dealership in Texas.
It was actually in the federal system, so it was transporting to and from military hospitals. It has some miles on it, but it's really in good condition.
David Russell, Assistant Chief of Operations for Clark County Fire District 6, says by the end of August, it will be ready.
And so this is kind of an insurance measure to kind of bridge the gap between AMR and a long transport time.
Level 0, or when provider American Medical Response has no ambulance to send, has become a problem across the Portland metro to varying degrees. Our KGW investigators looked at data from the first 6 months of 2023 in Clark County and found ambulances were busy and unable to respond right away on 3% of calls. In District 6, Russell explains they've been pretty lucky, but they still want to be prepared.
Seeing the stories that happen in Multnomah County with fire engines transporting critical patients, right? That's not a place to provide care on the floor of a fire engine. So we wanted to do something that would provide our citizens with a higher level of service and give our responders a place to work that is acceptable in the rare need that we need this.
All right, so how rare are they talking? Officials expect only to use this ambulance about 5 to 10 times per year when a wait time is longer than 30 minutes. We've reached out to AMR for comment this afternoon, but we have not yet heard back. David?
Yeah, still could mean all the difference for that handful of patients. Thank you, Alma.